She was in a near-fatal car accident.
My sister Felicia was in a severe car accident in June.
I am a multiple sclerosis patient. I was diagnosed in 2007.
Numerous problems with my spine.
So I've got lumbar spinal stenosis, congenital degenerative disc disease,
4 rods in my back, stenosis.
4 bulging discs with 2 pinched nerves.
She had 30 broken bones, was in a coma for 3 months. We went back to changing diapers.
I am inoperable, so I'm basically going to have to live with these conditions for the rest of my life.
What they call a diffuse axonal brain injury.
Her life is sustained by pharma drugs.
She's luckily down to 4 seizure medications, but that's not including the medications for her depression that they're trying to avoid, the blood thinners that she's on, the anti-nausea medications, the pain medications, the muscle relaxers.
Xanax 1 milligram 3 times a day, Tylenol 50 milligram once a day.
The stomach stimulants, the bowel intestine regulators.
Amitriptyline 100 milligrams at night. Mobic 15 milligrams once daily. Lyrica 200 milligrams 3 times daily.
They had me on OxyContin, and I'm a football coach for middle school football, and I could not coach my kids and do it effectively while I was on opiates.
Is this something you'd want your child to take? She takes 3,000 pills a month to just live.
She's 19 years old and is on 21 medications right now, and that's not if they decide to potentially add more medications to help counteract those medications.
I take 33 pills a day. I'm 27 years old.
And with all these medications, they are causing, or could potentially cause, drug interactions, further complications of her liver, which was severely damaged in the injury as well, causing internal bleeding.
And I took so much that it's hurt my liver, it's hurt my kidneys.
Everything seems to mess with the other one. There's not a coexistence between her and all these medications.
I was hooked on medication narcotics.
And I found cannabis to be much more effective in treating my muscle spasms and pain and neuropathy than the opiates that were prescribed to me by my physician. I used it to cease my addiction to the opiates that I was on for over 5 years, and I found cannabis to be a lot more effective in treating my condition.
With the medical marijuana, she could potentially get off of all of the seizure medications, get off of the ulcer medication because of the medications. She could get off the stomach regulators because it helps the bowels. She can get off the nausea medications.
We need her on this. We've seen the profound effects from Colorado. They showed them to us. It was protocol. Every one of those patients was able to eat. They were able to gain weight. They were able to keep some sort of stabilization within their mood. But now that we're back in Kentucky, we're denied this right.
Marijuana helps me with the pain. It doesn't take the pain away, but it helps me to cope with it, and I'll be having to cope with it the rest of my life. I choose not to take the opiates for the rest of my life to deal with this pain.
I decided to try to smoke some marijuana, and it did 100 times better than what the pain medicine did, and I didn't have the bad effects. I didn't feel sick to my stomach, get dopey, lightheaded, all that. I could still function as a normal human being.
My name is Katie.
My name is Jaime Montalvo, and I am from Louisville, Kentucky.
My name is Emily Fulkerson. I'm from Owensboro, Kentucky.
My name is Brandon Gross. I live in Ohio County, Kentucky.
My name is Dan Syme Jr. I live in Jefferson County, Louisville, Kentucky.
If you support medical marijuana here in Kentucky, go to our website, www.KY4MM.org, and show your support. Purchase a shirt, purchase a packet, share the site with your legislators, share the site with your family and friends. Help us to share the word and get this done so that patients can have safe access to medical cannabis as soon as possible.